point of flooding, she has fatigue, dizziness, and night sweats. So when I say flooding, she's using a super pad, a super tampon, and changing them every half hour, but still flooding through. She's also had 2 episodes at the ER due to flooding. And she says to her doctor, I don't feel like myself. Something's wrong. So she was offered birth control pill. She was offered the Mirena IUD as an option, which is actually a more progressive option. And as of late, she's been offered a hysterectomy in, you know what, there's one more thing she was offered that I actually didn't include here, and it's horrifying. It's a blood clotting drug. So blood clotting drug, here you go, and a hysterectomy. So a hysterectomy, for those of you who don't know, is the surgical removal of your uterus. And absolutely, if that's where she is, if that's the option, I get it. There are women that may need that. But like I wrote here, your period is trying to tell you something. These are signs of imbalance. We shouldn't be just treating this as an emergency. Something's going on here with Heidi. Something's definitely out of balance. Not every woman goes through this. And why aren't we addressing the hormones rather than just suppressing hormones with the pill or removing her uterus? In order to understand why Heidi's doctor suggested the hysterectomy and why she's not getting her hormones balanced and why she's not getting any attention from her doctor, we need to understand first what our hormones are doing in our bodies. So here's my hormones 101. Hormones and symptoms change, but women in perimenopause still get their usual cycles. And this, I'm going to say it again, hormones and symptoms change, but women in perimenopause usually still get their regular cycles. And this is why a lot of women don't think they needed to be on the call today, because if they have regular cycles, they think they just have PMS, but it actually often does constitute perimenopause if they're 38 to 50. So there are 3 hormones that are really involved in our changing cycles, our changing symptoms, and I'm going to go through them in detail, but just an overview. Estrogen. So estrogen is an awesome, feel-good, feel-happy hormone. We love it. But what we used to think is that estrogen declined before menopause. Before we reached menopause, we used to think that in our 40s, estrogen was declining. When I was in school, which was only 15 years ago, so in the early 2000s, we were taught that estrogen was declining. It's fascinating. We were taught this, and it is not true at all. Now we know, in fact, that estrogen is higher in perimenopause and it fluctuates. And Jerry Lynn Pryor coined the term estrogen storm season and wrote a whole book about it. And she's an amazing MD who does tons of research on women's health. And she's the guru on progesterone and estrogen. And she describes estrogen storm season as high, low, just constant shifts to levels that are higher than we had in our fertility years. And I'm going to jump into estrogen in more detail in a minute. Now, progesterone is our other predominant hormone. It occurs most abundantly in the second half of our cycle. So after we've ovulated, we get a big rush of progesterone if things are all nice and balanced. Estrogen is calming, it's soothing, it's anti-anxiety, it helps us sleep. It's also anti-inflammatory. It helps reduce inflammation in so many amazing ways. And cortisol. So cortisol is one of our stress hormones. It goes along for the ride. When estrogen spikes in perimenopause, so does cortisol. So I will get to why you feel anxious in a moment. Now, here is a graph that for those of you who don't know how to read charts, please ignore this and I'll explain it, because I know that sometimes looking at graphs can be like mind-blowing. So the point of this is to explain the different phases in a woman's life, and to understand that if you were to just Google hormonal phases for women, this is not typically the image that comes up. And Shirley and I talked about this earlier. It's actually, we're very hard pressed to find something on Google that's accurate. So what happens is, I'm going to take you through our phases. We have puberty, where, look at that, estrogen is erratic. That's our puberty phase. Next is our fertility years. So these are our fertile years. Some people call them the premenopausal years. We're going to call them the fertility years for our purposes here. Next, we have the perimenopausal stage. And this is 7 to 13 years before a woman reaches the point of menopause. So perimenopause is the transition phase. It's a life cycle. It's an absolute period of time. Whereas menopause is a point. So you will go through perimenopause, you will reach menopause. The moment you don't have a period for 12 months, boom, you've gone through menopause. You've reached it. And then after that is postmenopause, and that's the rest of your beautiful life, which might last dozens and dozens and hopefully more than that years. So what's going on here with progesterone? Now, progesterone is our feel-good, calming, anti-inflammatory hormone, and it's in green here. And progesterone rises, and then in the fertility years, it's quite high, and it's awesome, and it makes us feel chill, and we can handle anything, and we can have babies, and it's great. And then perimenopause, it plummets, and this doesn't feel very good. So this makes us anxious and angry and irritable, and we can't sleep, and periods get heavier. And look at that, like it just keeps plummeting. Like that's quite a drop there. Now estrogen, on the other hand, here it is at baseline. Look what it does in perimenopause. It spikes higher than it did in puberty. Higher than puberty. We have more estrogen. We have 30% more estrogen in perimenopause than we did in our fertility years. It's actually astounding. No wonder we feel irritable. So those are our phases, and that's what the hormones are doing. I'm going to talk specifically about the hormones now. So what is estrogen? Estrogen is what we were just talking about. It goes sky high in perimenopause. It helps us to manage our blood sugar. It actually keeps us full. When we have low estrogen, we're hungry all the time. So it normalizes our blood sugar. It helps to support our blood vessels. It maintains brain health. So there's a link between low estrogen and dementia. It helps with memory. It helps to support bone density. So low estrogen results in more bone fractures, possibly. It contributes to a healthy microbiome. So it helps with your digestion. And it supports mood. It's very helpful for feeling very happy and joyful. And it supports a healthy sex life. It's great for libido. So high levels of estrogen, however, is what we're experiencing, those erratic shifts in perimenopause. The high levels cause awful symptoms. You don't just get happier, you get cranky. So high levels of estrogen that are unregulated and imbalanced cause breast tenderness, heavy bleeding, fibroids, irritability, bloating, anxiety, low libido, fatigue, and headaches. So that's a lot of things that we don't want to feel. Now, low estrogen on the other hand, so post-menopause, once you reach menopause, then your estrogen starts to decline, like we looked at on that chart. After estrogen starts to decline, we start to see weight gain, hair loss, depression, insomnia, dry skin, bladder infections are actually very common, and vaginal dryness. So the symptoms of perimenopause and post-menopause are very different because one is characterized by high estrogen, one is by low. Please let me know if you have questions about that too, because I know this can be confusing. Current research shows that even women 3 to 11 months without a period still have elevated estrogen levels. So these women have not officially reached menopause, but they've not had a period for 11 months and they still have high estrogen levels. So if you go to your doctor and you haven't been without a period for more than 11 months, you should never be offered estrogen unless it is darn clear that your estrogen has dropped. But by symptoms alone, you should never be offered estrogen at this point. So estrogen levels are about 30% higher in perimenopause than they were in their fertile years. And I just think that's astounding. And that's where medicine's got it all wrong. So a lot of Older doctors who haven't kept up with the research are still prescribing estrogen for hormonal shifts in perimenopause. Now, progesterone, on the other hand, it is down so low in perimenopause. After age 35, our levels of that calming hormone really start to decline. So you get that high estrogen and low progesterone, and the discrepancy between the two is what causes the imbalance. So Jerry Lynn Pryor, the guru, says our understanding of perimenopause has been biased toward estrogen. And she's even saying that just last year. It's still astounding that how biased our medical system has been toward misunderstanding the role of estrogen in perimenopause. Now, progesterone, here's my Zen yogi here. Progesterone induces calm and lowers inflammation, as I've already mentioned. It promotes sleep, it thickens the lining of the uterus, it maintains pregnancy, it's anti-inflammatory, it also protects the brain. A lot of the way that it protects the brain is by being anti-inflammatory. And best of all, it balances the effects of estrogen. So take note of that. When you've got estrogen storm season and you have really high estrogen in perimenopause, progesterone will calm that. It will just ease all your symptoms. It's actually quite amazing how the two work in concert, and it really is important to balance these two together. Imbalances in progesterone, so a low progesterone beyond what it should be, can result in symptoms related to high estrogen. So you might notice weight gain, heavy flow, mood swings, anxiety, breast tenderness, and migraines. Now, this wouldn't be complete if I didn't touch on testosterone. I did have to just mention this. And first, I'm going to mention how outdated the research is. Again, note the chart and note on this x-axis how menopause is the phase. But ignore that, please. Everybody just delete that from your mind. If nothing else, it goes to show that Google is so tricky. And it always shows menopause as a phase, when in fact, perimenopause is the phase. Menopause is the point. So when your estrogen plummets post-menopausally, after the point of menopause, so does testosterone. And low energy, low libido, yes, it might be estrogen, but make sure you ask for a testosterone test too, or check in on testosterone. Because if you have abdominal weight gain, that's otherwise you can't figure out, it's either insulin resistance or it's most likely testosterone. It's not estrogen that causes abdominal weight gain. It's certainly testosterone. So this is for, was it Colleen who mentioned? So a diagnosis of perimenopause is made in midlife women when they have any 3 of these 9 changes. So I listed off a ton of symptoms there before, but if you can tick 3 out of 9 of these or more, you know you've met perimenopause, and that is, as Shirley would say, a hormone imbalance that we need to treat. So if you have a new onset of heavy or longer flow, if your cycles have shortened, so we'll often see women come in where they get their period every 2 weeks. If you have new sore breasts, if you've started to wake up in the night, increased cramping, onset of night sweats, particularly right before your period, new migraines, or they've become worse, new PMS mood swings, and weight gain without changing anything in your exercise or diet. It's not just PMS, it's a perimenopause hormone imbalance. So please feel free to take notes on this